Okay, the next question, once again, reading verbatim, and we're going to start with you, Mr. Smith. There is much discussion by presidential candidates about wanting to make sure everyone in America has health insurance. What will you do if elected to ensure North Carolinians have health insurance? Mr. Smith.
Thank you, Mr. Davis. That issue is obviously the centerpiece of my campaign, and I believe, and again on my website I've got a specific discussion of the ideas. There are ideas on the table today that will work. We need to expand Medicaid to 200% of the federal poverty level, and we need to include in that the ability for consumers and for people who fall within a range to pay a portion of that cost. Now, I know some people don't like the idea of expanding Medicaid. I think that's an important solution because the reality of it is that business in North Carolina is already paying the cost of uninsured. They're not paying for it directly. They're paying for it indirectly through higher costs through the doctor, through the hospital, through pharmaceuticals. We have to do something about that issue. Expanding Medicaid to reach that population would be a good first step. The second thing we need to do is implement Governor Easley's and the legislature's plan for expanding the children's health insurance program in North Carolina. And now that we know that the federal government cannot limit that, we need to move aggressively forward so that we can get every child in North Carolina so they don't go to bed any night without health insurance. But it's also more measured things on the private industry side. We have to find solutions that will work. And the first thing we have to do is talk about cost containment. We know in the last 10 to 12 years that the average health insurance cost rate increase, the medical inflation rate in North Carolina, has been over 10%. And what that means is that now for every business in North Carolina, health insurance costs are their number 2 expense. And if we don't address that issue, it's going to get worse and worse. One idea is that we go ahead and start dealing with wellness and start implementing wellness ideas and putting them into health plans, give businesses a tax break for the money that they spend on implementing wellness plans, and also bring together multiple states to start sharing the risk of the high-cost claims so that we actually are able to lower the cost of health insurance for small businesses. I believe this is a critical issue, and if we don't do something about it, it's going to be a bigger crisis than it already is.
Mr. Goodwin, 2 minutes.
Thanks, sir. Once again, I have a proven record on this. As a member of the legislature, I helped introduce and also co-sponsored legislation to help move along the children's health insurance plan that is there, the CHIP program. Also in the legislature, worked on the Patients' Bill of Rights. It passed in North Carolina. Working as the Assistant Commissioner of Insurance, working with industry, insurance industry, with the private sector, with legislators, with the consumers, we helped pass the high-risk insurance pool. That's going to help folks who presently cannot get insured. There's still things we can do to help make that program even better. As a member of the legislature and after serving the legislature, I've worked on the very issue that David's talked about, Medicaid. There are some folks who fall between the cracks, who do not earn enough money to purchase insurance, but earn too much in order to receive Medicaid. We need to do what we can to ensure that folks are insured regarding health insurance. We must close the gap. One other point I want to make briefly is that I also co-sponsored legislation years ago, and time again, it's come up many occasions, like Representative Goforth has done, is to provide greater incentives for our small businesses so they can be able to provide health insurance as part of their employment package. Final point is this. I hear Mr. Smith talking about cost containment. That is a concern, but if you go too far, David, you're talking about socialism or communism. You've got to be careful about that because you are talking about businesses, you're talking about a capitalist economy. We've got to do what is measured to make sure that we provide health insurance for everyone, but it is done in a way that keeps with the type of society that we are accustomed to. Health insurance is important, but we've got to make sure it's done the right way and not the wrong way. I'm Wayne Goodwin, candidate for Insurance Commissioner.
Mr. Smith, socialism, communism, a capitalist economy.
Big words. I say to that real quickly, business is not the enemy. And what the problem today is that there's no leadership on this issue. Whenever there's been a higher cost for workers' comp insurance, there's a crisis in the legislature. The problem is that this issue is not a crisis, and there's been no leadership on this issue. And we need leadership. Cost containment is about sitting down at the table with doctors and hospitals and pharmaceutical companies and providers and insurance companies and saying, we need to find a solution. They're committed to that idea. What insurance companies want to do is be able to provide that coverage more affordably. What doctors want is to be able to continue to make sure that the people that they're seeing are getting paid promptly and not over a period of time. At this stage of the game, we need to have the discussion, and the problem is I'm the only one talking about this issue.
Comments?
the public needs to know that the General Assembly has limited the jurisdiction of the Department of Insurance and the Commissioner on issues of health insurance. What we can do right now is more bully pulpit, and you're hearing a lot of bullying right now, unfortunately. But we do need to move the state forward, and whatever the public wants to have its insurance commissioner do on this issue, it will require the legislature to act. So we need to encourage our small businesses and business owners, if they want to see action done on this, it needs to be a twofold effort. Leadership by the insurance commissioner, and I have that leadership experience. I've served in elective office and know what it's about to speak up on key issues for the public. But we also need to encourage the legislature to act as well. Right now, we do not have complete jurisdiction over health insurance, and to say otherwise is misleading.